Hello and welcome to RCSI University of Medicine and Health Sciences. I'm Dr. Trudy Meehan and today we will be talking about debunking the myths, talking to teenagers about sexual health. This panel discussion forms part of the RCSI MyHealth Series. The series explores a range of topics in health and well-being and draws leading healthcare experts in the fields, with the goal of empowering people with knowledge to make informed decisions about their health and well-being. In today's panel discussion, we will look at how to engage with young people when talking about their sexual health. We received a number of questions from the public, and we've done our best to incorporate those questions into the discussion that follows. Today, I'm joined by Professor Fergal Malone, Professor and Chairman, Department of Obstetrics and Gynaecology, RCSI, and Consultant Obstetrician, Rotunda Hospital, Dublin. Dr. Zara Molphy, Head of Research Programmes, Department of Obstetrics and Gynaecology, RCSI. Dr. Ronan Daly, Clinical Lecturer, Department of Obstetrics and Gynaecology, RCSI. Welcome to the RCSI MyHealth Series. Fergal, you and your team have developed a programme called Debunking the Myths, the science behind sexual health. Can you tell me a little bit about why you developed that programme, the motivation behind it? Was there a gap that you identified?
Well, Trudy, in today's era of fake news, it can be very difficult for teenagers to access reliable sources of information on sexual and reproductive health. Indeed, many teenagers get their information on sexual and reproductive health from idealized images that they see on the internet, social media, TV, film. And many of these images do not correspond with the reality of most people's body images. Previous research has shown that there's a significant gap here. An ESRI study in 2020 looked at data behind teenagers' understanding of talking about sex and where they get information. And it showed that there was a real gap, in particular amongst males from lower income groups, and in particular from males in rural areas, where they didn't seem to have as much access to reliable information. And this is a real problem because we have found that when you look at 13-year-olds, the majority of 13-year-olds get their information on sexual and reproductive health from their parents, but the majority of 17-year-olds get their information from peers and other teenagers. And this has real consequences because teenagers who get their information on sexual health from other teenagers are significantly less likely, for example, to use contraception the first time they have sex. So there's real consequences towards this gap in knowledge at the moment.
Wow, so you identified a gap with some very significant consequences. And I imagine there's been some benefits to your programme. Can you talk to us a little bit about some of the benefits you've seen?
Well, clearly there's significant benefits in that we have had large numbers of teenagers from schools throughout the country who have accessed our information, have given us feedback on how useful it is. We have heard feedback that the current RSE curriculum is very helpful and very useful, but it's often considered too little, too late, and it doesn't seem to hit the particular topics and particular targets that students themselves, the teenagers themselves want. So we found by giving young people access to reliable sources of information they can depend on is really helpful. And in parallel with that, we need to empower teenagers to judge where are those reliable sources of information. We can give them facts now, but even more powerful is to show them how to judge sources of information for the future. Then they can get the facts for themselves into the future.
Wow, that's really a great model. You've touched on some of the topics that you have included in the programme, and Zara, you're one of the programme co-leads. Would you be able to just give us an overview of some of the topics that are included in the workshops and maybe some of the work you've done to date?
Yeah, sure, Trudy. So some of the topics that we have brought into the curriculum of Debunking the Myths is STIs, contraception, sexual assault treatment unit, consent, periods, anatomy, both male and female. And with the help of the funding we've received from SFI and from the Rotunda Foundation, we have rolled out workshops since September 2022. So in the last couple of months, we've engaged over 1,200 students in person. We had a workshop online where we had 1,400 students enrolled. And those students that enrolled online, they would have received kits to their schools, so it would have been a very similar experience to that of those that came to in-person workshops. And then in March alone, we've had 500 teenagers through the door, and in April we'll have an online workshop where we will have 3,000 students engaged.
Wow, that's a really lovely reach. And one of the things that I heard the programme includes is it allows young people to submit questions anonymously. Can you tell us a little bit about that, and has it been beneficial for you as programme developers to hear directly from young people?
Yeah, absolutely. It sure has helped us in the content that we deliver, in the slides that are created, that are constantly updated to contain feedback that teens give us. So the way we operate is we have an online forum. They come into a room, or again online, they scan a QR code. They can see on their phones or on their school tablets the slides that are presented by the expert speaker. They can flick through the slides, they can go back if they want to read something again, but at all times there's an option for them to hit question, and they can type their own free-flowing question on any topic that concerns them under the remit of Debunking the Myths, and the speaker will either answer directly after the talk, or at the end the panel may sit and do a full round of questions on any topic that comes in during the course of the workshop.
Wow, that sounds amazing. Ronan, Zara mentioned that there was some key topics that came up for young people. Would you be able to just briefly give us an overview of almost the main areas that you think we should be focusing on, or that you've learned we should focus on?
Yeah, so we try and cover a range of topics that are relevant to them as young people today. So one of the things we do to help to orientate the people attending to the topic is we'll talk about anatomy, so anatomy that's relevant to sexual health, so male and female reproductive anatomy, just to help kind of initiate them a little bit more into the area. Piggybacking off that, we would also discuss topics such as periods and menstruation, which give people who have experience of that the opportunity to ask questions about what's normal, what's not normal, and gives them a chance to kind of learn a bit more about it. And for some people who have never had any experience or know very little about that area, it gives them kind of a new exposure and gives them a bit more information. We always ask for questions, and one of the two topics that we get probably the most questions about are things to do with contraception and STIs, and I think that there is a real appetite from young people for advice and information about those topics that are so relevant to them, but that comes from a medical perspective. And then we do also talk about consent and the sexual assault treatment unit, so we get in experts who have worked in that area and were in that field to talk to students, and I don't think any discussion about sexual health in young people in Ireland today could be complete without also discussing sexual assault and consent as well.
Yeah, no, that's great, that makes a lot of sense. Fergal, if you don't mind, I'll come back to you and ask you a little bit about, you mentioned contraception, and Ronan mentioned it as one of the key topics as well. Can you give us maybe just an overview of some of perhaps the misconceptions, but also the key things you'd like people to know about the area of contraception?
Well, unfortunately, there's a lot of misconceptions out there about contraception. And one of the benefits of our programme, by empowering teenagers to ask whatever question they want anonymously and without judgment, is that we find out what those misconceptions are. And one of the more common ones that we hear is that when you're taking the contraceptive pill, you have to take a 1 week break with it. Now, of course, that's not true. The contraceptive pill, one of the main reasons it was originally developed was not just contraception, but for menstrual cycle regulation. So that's the main reason that you have 3 weeks of taking a pill and a week off. And that's to give menstrual cycle regulation, really, rather than contraception. So if a teenager or young person wants to run back-to-back pills, or indeed take a shorter gap between pills, that's perfectly acceptable. For example, if a teenager has an exam coming up and it just so happens that their 3 weeks of their pill is finishing up in the middle of the exam and they're worried that they're going to have some bleeding, then they can continue right through into another pill pack. So back-to-back pills are very common, and teenagers seem very taken by and interested when they hear that reality. Another common one we get is the morning after pill, and is it true that the morning after pill has to be taken only on the morning after? Whereas nowadays, while we would encourage people who find themselves in need of the morning after pill to take it as soon as possible. But there are versions of the morning after pill that are perfectly effective up to 3 days afterwards, and some that are as effective up to 5 days afterwards. So there's no huge urgency. It's good to get your treatment as soon as possible, but there's no huge urgency that, oh, I've missed the first 24 hours, it won't work now, it's hopeless. That's not the case. And again, that seems to resonate with young people, that there are options there.
Yeah, that's really great to see that there's a bigger window there as well. Thanks for that. You touched on periods, so I'll jump to Zara if you don't mind, and I know periods is one of the topics that's covered in the sessions, and even though it's an everyday experience, I imagine there's huge individual variations and still lots of misunderstandings around the topic. Can you give us just some of the topics or questions that young people bring to you or that you communicate about?
Yeah, absolutely. So some of the misconceptions would be, I can't get pregnant if I'm on my period. That's not necessarily true. There is obviously a lower risk associated with having sex while on a period. However, teenager cycles are quite irregular the first couple of years while they have them. So it's not necessarily a 28-day cycle with ovulation at day 14. So there are risks. So obviously protected sex is the safest option in that case. Another, it's actually really interesting on during the slides for menstruation, we ask questions and we have polls where teenagers can vote for different answers. And one of the kind of topical ones is, what age should I expect to get my period? So the age range is quite wide. It can be anything from 10 to 15 years of age. And then you do get questions then submitted. It's like, oh, I'm 16. Should I be concerned? I don't have my period just yet. So in case like that, we would advise to go speak to a GP, go have a chat, and then discuss further with family and with the GP. But definitely the age range and then the duration of a period, how long it lasts, typically between 3 to 5 days, but some can be shorter, some can be slightly longer. So there is no real norm for teenagers. Periods by nature can be quite irregular at that time, but we would advise, again, anything longer than 7 days, again, to go speak to a GP.
Okay, great. That's really helpful. Thank you. Ronan, the programme promises evidence-based information, but one of the other really nice things about the programme is that it also promises non-judgmental information. And I imagine that's particularly important in the area of sexually transmitted infections. Can you tell us some of the areas that young people are interested in, or maybe some of the misconceptions that they have about STIs?
Yeah, so I think we try and come at everything from an approach of a non-judgmental approach when we're discussing anything at the debunking sessions, but I think it's particularly relevant to STIs. The goal or the purpose at the sessions is not to, add to the stigma or the shame that people may feel if they have an STI. So, we don't show students, pictures that are intended to shock them or scare them or anything like that. We try and give them information that they can use and resources that they can use themselves to access. So I suppose one of the common things we get asked is, how will I know I have an STI, or will I know if I have an STI? And we do tell, the young people who attend that STIs are often asymptomatic, that a lot of people won't have any symptoms, but they can have very significant health consequences for them. So we do, also tell students about the possibility that they may have, lumps or bumps or skin rashes. They may have discharge or painful urination. So we do tell them the symptoms they may have, but also that some STIs will have no symptoms at all. So we do really strongly highlight the importance of, getting tested. And going for an STI test. There is a lot of myths and misconceptions among students around STI tests and what happens at them. So we try initially to encourage students and young people when to go for an STI test. So if they have a new partner, if they've had unprotected sex, if they know their partner has an STI, or if they have any symptoms as well, there would be reasons why we would encourage them to go and get tested. We walk them through what happens at an STI test from the minute they make the appointment to when they walk through the door to when they go home, and how they're followed up. So to try and make sure that they're as informed as possible about the process and take away some maybe of the fear about going. We get a lot of questions as well about the different STIs and the symptoms that they present with. So we do go through those. We talk to them about the different treatments or managements that are available for different STIs. We do also get questions about, things like HIV transmission. There's a lot of questions questions of, can I get HIV if? And we try as much as we can to deal with those questions in the slides and in the presentation, but also if they ask them at the roundtable discussions at the end, we do go through a lot of those topics and trying and minimise the concerns or the fears that some students may be dealing with. And we also tell students about the improvements in sexual health over the last few years, the things that have been achieved, and that a person with an undetectable viral load is not transmissible, cannot pass on the virus or transmit the virus to another person. So we do try and make sure that they have a fairly global understanding around sexual health and STIs. The other things that we would also discuss or that they often ask about is, where to go or how to access STI testing, and particularly, do they need to tell their parents about it? Do they need to go to their local GP to have it done, who's been their GP forever? So we would usually tell them, know that there's many clinics across the country. There's the Guide Clinic in James's in Dublin, which is fantastic and has a particular clinic for young people, which allows them to access STI testing. We also talk to them about sh24.ie, which is an Irish website which will provide people for free with home STI tests for anyone over the age of 17. And that is something I didn't think just that they have as much access and awareness of the resources that they can use and go to as possible.
That's a really great resource, and that they can access them for free and at home. And oh, that's great. And you've brought up an interesting point around age, because I think there's often a lot of confusion around at what age do you need to be for certain services. So Fergal, I'll just come back to you briefly around the issue of contraception. What are the age ranges and some of the questions that young people might have around that?
Well, Trudy, we perceive one of the significant barriers to young people accessing contraception is this fear or concern that if you're 16 or 17 years of age and you go to your GP, the GP is going to have to tell their parents, or they're going to have the consent of their parents, and they may not be comfortable with that. It's important to realise that the age of medical or surgical consent in Ireland is 16. The age of consent for sex is 17. So there's absolutely no problem with a 16-year-old engaging with their GP privately, confidentially, without the involvement of their parents, and being able to consent for medical treatment, which includes contraception. Not all GPs, however, may be comfortable prescribing contraception to a 16-year-old without involving the parent, but they would require the consent of the teenager to do that. So we would certainly encourage a dialogue or a conversation between the young teen and their GP, but they are absolutely entitled to consent to their own medical treatment after 16. It's also important to realise that with the new great programme for free access to contraception for 17 to 26-year-olds in Ireland, they can engage with their GP and be expected to be prescribed contraception for free. And not only that, pharmacists are now also able to prescribe or to dispense over the counter and without a GP's prescription emergency contraception to a 17-year-old. So there's absolutely no problem if a young teen finds himself in a situation that time is of the essence, they don't want to or don't have time to see their GP, they can absolutely see a pharmacist, and emergency contraception can be dispensed.
That's really important information. Thanks for sharing that with us. Ronan, I'm just going to come back to you, because one of the lovely things that you said is how you walk young people through the experience of going to a clinic. And I suppose one of the challenging experiences for young people who have to come to a clinic or a service might be if they have to contact the sexual assault treatment unit. Can you talk us through what they might expect, or what, some information that might demystify that experience for people? Yeah,
so I think it's an important topic to discuss with young people at the sessions. We know that about 24% of attendances to the sexual assault treatment units are people who are under the age of 18. So it is a significant issue and reason for presentation at these clinics. So it's important to raise it with students and make them aware of it. So we do advise them about the possibilities that, when they go, what to expect. So, the different types of examination that may be involved at it. We would also discuss them that some people would go for forensic examination, not to involve, the guards or make an official complaint against someone, but for even things like follow-up for counselling following sexual assault, emergency contraception, STI testing, all those things as appropriate. So it's a service that's there even if it's not something someone is pursuing legally, but that they may wish to have more information and more support from, and to also allay any health concerns that they may have. We usually do get a lot of questions in regards to sexual assault. We would, often have questions about or misconceptions about, a person who will have a lot of injuries after a sexual assault, and we know that that's not the case. That often there won't be any visible injuries or significant physical injuries after a sexual assault, or that it's a stranger on the street and that kind of thing. And we know from from research and presentations to the sexual assault unit that that's not always the case. It's often someone that the person knows themselves. So those are the kind of things we try and talk to them about and make them more aware of. We also would talk them through the different types of examinations that they can expect to have and what the role and the purpose of the SATU is. We try to give them as much information as possible in regards to how to access it. So we would direct them to the HSE website, has a lot of really good resources about where to go and who to call with actual phone numbers and things like that. That young people can access that, and also what to do if a friend confides in someone that they've been sexually assaulted or that they've been raped, that they have a bit of resources and a bit of knowledge that they can use to help others. And we encourage them to be comforting, to be supportive, and to try and guide them in the right direction. So the information that we give to those students may not hopefully ever affect those students, or they may never need it, but that for others even down the line as well, that they may be able to support others in that too.
That makes a lot of sense. Thanks, Ronan. What's really coming through is the real value of having information and reliable information. Zara, can you point us to some additional resources that you and your team have felt are very helpful and that parents or caregivers should know about?
Yeah, so we have a really great website, www.debunkingthemyths.ie, and there's a resource tab there which links you direct to a whole variety of different websites, such as sexualwellbeing.ie, which is a wonderful resource. There's a great tab for contraception, and it talks through all the different types of contraception that are now covered under the new contraception scheme. Another great one is sh24.ie. So this is the STI kits that Ronan has just spoken about. So how you go about ordering them, the information that's required, and the types of tests that they offer. So sh24 and sexualwellbeing.ie are really great ones.
That's great. Thank you very much. As we wrap up, it's a very difficult question in a way, but if you had one thought or takeaway message that you'd like people who are listening or watching today to take away with them, what would that be? So Fergal, I'll put you on the spot first. What might that be for you?
Well, I think the one takeaway message for young people, teenagers in particular, is there is now free access to contraception. Engage with your GP. You do not need the consent or to inform parents. Discuss things with your GP. Discuss with your GP whether or not you want to involve your parents. But there's absolutely no problem accessing all forms of contraception now. The other message I'd like to just underscore for parents and teachers is there's nothing in our program that is designed to undermine their role in the RSE curriculum. In fact, the feedback we've heard from teachers is they really appreciate the added value that this is giving. So we're not trying to do something in parallel with Department of Education goals, but really just to support and fill this real knowledge gap that's there at the moment.
That's great. Thank you very much. Zara, the same question for you.
I guess through our Debunking the Myths programme, we hope to remove the stigma that's associated with conversations around contraception, periods, STIs. So we hope that it empowers teenagers, parents, caregivers to discuss openly and confidently about their concerns in relation to their own health.
That's really important. Thank you very much, Zara. And Ronan, for you, what would be your key message you'd like to say?
I suppose the stigma around STIs has been significant, and we do know that there's between the ages of 16 to 25 the rates of STIs like chlamydia are rising, and they are going up, but which can be a scary statistic, but at the same time, we know about those cases because people have gone and gotten tested. So I think just to highlight the importance of going to get an STI test, whether that's in a clinic or whether that's by using SH24 and getting an STI kit sent to your house. Those are just kind of important things to be aware of, that there shouldn't be any concern or fears around going for an STI test, and that again, it's looking after your own health, it's taking responsibility for your own health, and can really make a significant impact on your own reproductive and sexual health going forward.
Thank you very much. Really important messages today, and I really love breaking the stigma as well, and messages of care, so thank you. That concludes our discussion for today, and I'd really like to thank our panellists, Professor Fergal Malone, Dr. Zara Molphy, and Dr. Ronan Daly. Thank you. Further details of the RCSI MyHealth Series can be found on the RCSI website, and all episodes of the RCSI MyHealth Series can be found on any major podcast platform. From all of us here at RCSI University of Medicine and Health Sciences, thank you for joining us today.